As midwives, we have the ultimate best opportunity to really make change in health, because you get women at a period of time when they're not in a crisis. You have the prenatal period to work with the women, and I think that the reason we get the outcomes we get is because of the relationships that the midwives make with the women. But it's the right thing to do, because we have these three silos in this country. We have the birth center, which is a silo protected to some extent by Medicaid, not as it should be. And then we have the silo of social supports and case management, which is Healthy Babies Project, had become a Healthy Start site, doing home visiting and education, and the silo of early childhood development, which comes under yet another federal program. Whenever we've done briefings on the Hill, we've always talked about connecting these three silos to have them more efficiently and more directly represent what families need, and rather than dividing it up by education, social supports, and health care. So we like to say that we're setting healthcare in its social context.
We actually have better outcomes here at the Family Health and Birth Center than any place in the whole district, even though we have the highest risk population. We don't reduce disparities, we reverse them. People who come here get better outcomes than the average in the district. And we're building not only healthy moms and healthy babies, but healthy families. Going forward, this has implications for a whole generation.
This place was founded to care for and improve the outcomes of the women of our neighborhood. Help them to be empowered, to take control of their birth, and then the care of themselves and their families.
Our goal is to stay connected to the community and to provide a safe place for them, a place where they can call a second home, where people are smiling, where people know their name, where we laugh out loud here, where we hold babies here. That is the air that we always want to provide. When you have a safe place, you feel better about coming in to get prenatal services. You feel better about talking to someone about what's going on in your home and getting good social care, so that all of those social things that are going on are taken care of. They work hand in hand. The physical, the mental, the social, they know they can come here, they get strong support, and they get it from people who are non-judgmental.
Anytime when somebody wants you to care about what you're doing to yourself, just makes you just start caring about life. To me, this building feels like we give people heart or love, that they can trust in different things that's bigger than them and themselves.
You're in an environment, no matter what's going on the outside, once you push that call buzzer and you come in, you know that everything is fine, everything is confidential, everything is safe.
When they walk through our doors and we tell them, you're here because you need to have a healthy baby and a healthy pregnancy, and you're in charge, and we're going to help you through this process, and we're going to educate you, and we're going to share with you, but you're going to make decisions and you're going to be responsible for your health.
I'm a firm believer that it takes a village to raise a child. The more support you have, the better the outcome. A client may have a visit with their midwife or healthcare provider and still be left with questions, or a question may come up later. And so here I am to come behind them to follow up. How did your visit go? Did you make your appointment? Yeah, I made it, but I still have this one question. So it's like we're overlapping and covering one another and educating, holding their hands as they go through to ensure that they have a positive pregnancy outcome. Then we move them past actually having the baby, and mom is ready to return to, let's say, the workforce or back to school. It's great to know that there's a daycare option here, all under one roof. It's good to know that they can also have their children receive their pediatric care here under the same roof. So I think it's important. One-stop shopping is like what I like to call it, to have everything all in one place, all of your services in one place.
Moms have expressed a feeling that they feel like they're cared about, and they appreciate that. I mean, they feel like somebody's interested in their well-being and their children's well-being. As nurse practitioners, or pediatric nurse practitioners, we see children and infants from birth through 21. And when you turn 21, we have to pass you on to someone else. And some go kicking and screaming. They don't want to leave. I like to see the families grow. I like to see the kids come through and not have any problems. This is more of a preventive type atmosphere. I've been around for a few years. I've seen some of the problems, some of the diseases, some of the conditions that kids get. We're trying to prevent that.
Our culture is at a very strange time in a way in terms of how the messages they give to women. Women are told in practically every area of their lives that they can be anything, do anything, except in one area, and that has to do with childbirth. This place is 180 degrees from that. We tell women, of course you can do the job. People have been doing this job forever. They still are in most parts of the world. And that message just permeates everything we do.
I can't empower anybody. They have to empower themselves, and it's a process. And it begins when they choose us. Sometimes they choose us just because we're in the neighborhood, but they don't know that they've chosen us because we're going to help them to empower themselves to take care of the pregnancy so that they have a good outcome. During group, they get a chance to share with each other, share their experiences. The women who have had babies share with the ones who haven't. The sharing helps to empower them, that they weigh and blood pressure themselves and keep track of their vital signs and how their babies are growing.
When we say something that usually happens in pregnancy, and when a mom says that happened to her, and then it just starts this big conversation between the moms. Everybody was talking. Like, we were supposed to be playing Two Truths and a Lie, and next thing I know, we're talking about pumping. I'm like, okay. They just wanted to hear about pumping. We was talking about sore nipples. And then they started the conversation on their own.
My oldest, my 6-year-old, I was 16 when I got pregnant with her. I started receiving prenatal care as early as 12 weeks. And they made me feel so comfortable, worked with me to help me with my self-esteem. I was able to talk about my day in school, what was bothering me. I didn't have many friends in school, so my midwives were my best friend. We had something in common. You know, they knew about my pregnancy, so I connect with moms on a personal level. I feel as though the only way that you can get a mom to open up is if you open up to them, just to let them know, hey, I've been there before. You know, we have moms from different ages, different races that come in, and I click with them because there's something. And they'll look at me like, you've never been homeless. Yes, I have. You don't have 3 children. Yes, I do. I mean, it's like, I still struggle. You know, I still struggle every day. My sisters had my back, or they've been through the same thing that I've been through in a different time, or may have been going through it at the same time. And I connected with them. Not only were we co-workers, we don't even call each other co-workers. Our children call each other Auntie Joan, Auntie Tina. That's how it is. So it's a very family-oriented place, and you're around so many positive people.
It's amazing. Every time I'm at a birth, it's amazing all over again that a new human being just was born. It's sometimes a very surreal experience. It's a privilege to be a part of it all and to be able to witness those very intimate and very special times in a family's life, especially here at the birth center, where you come back into one of these beautiful rooms and everything is focused just on that woman and just on her needs and just on her baby, and it's quiet and it's exactly the environment that she needs it to be, because we can make it that. It's a really special experience.
To be able to give that to somebody, I think, is really amazing, especially a first-time mom who's young and scared. And when you can give her the, like, I did it, like, sensation, like, I made this baby, I pushed this baby out, I can feed this baby, like, it's my child, I think it does a lot for helping them to be, like, good mothers and feel confident as mothers.
If there were more birth centers, maternity care would be very different in this country. As it is right now, as you may know, of all of the developed countries on the planet, we have the worst outcomes. 50 states have better outcomes than the District of Columbia. So we're dead last, literally, both in the country and among developed countries. Unfortunately, the way things work in the United States right now, we pay a lot of money for bad outcomes. It's really too bad. It's bad for moms, it's bad for babies, it's bad for the pocketbook, and it's really bad for society.
Even when you make substantial improvement in outcomes, you still cannot get paid for what you do. And so we get about half of our charges for, even though we save extraordinary amounts of money for the system. Actually, in 2006, we saved more money for the system because of lower preterm birth, lower low birth weight, and lower cesarean section. We actually saved more money for the system than our operating budget. But we could not get what we billed for. If all Medicaid supported births were managed on our model, it could save billions of dollars for the country. It's been interesting that we've had lots of visitors come here. Nobody has ever said to us, this can't work. Everybody says, this is what we need to do. I keep hoping, that somebody's going to see the light somewhere and be willing to fly in the face of these for-profit organizations that are making out like bandits on the work that we do and on the families. They need some comeuppance in my estimation, but they're probably, they have their own connections, and we're only nurses after all, and we're only women.